Hello, my name is LJordan. I'm going to be doing a head-to-toe assessment on Scott here. Scott, can you tell me your date of birth for me, please?
July 6, 1967.
Perfect. And who's the president right now?
Doofus Trump.
Okay. And why are we here today?
To doing this, you're going to take a look at me head to toe, make sure I don't have any problems.
Okay. Perfect. So prior to this, I already did, I obtained Scott's height and weight. I obtained his vitals, and I also did a Sneller's test. He doesn't wear glasses or contacts, and his vision was 20/20. Also, for the purpose of this assessment, I'm going to have him, he's going to stay clothed, so he won't be derobing on those certain points of that assessment. And also, we are going to opt out on gynecological and any kind of GU. Thank you. Okay, so I'm going to go ahead and I'm going to start with inspection. I'm going to be looking at his face, looking at symmetry, which appears to be symmetric on both sides. I'm looking for any rashes, lesions, any kind of abnormal skin coloration. He looks nice and pink, no grayness, doesn't look like he's having any oxygen issues whatsoever. I'm going to go ahead and palpate the front of his face. So you feel me touch, and I've already washed my hands prior to coming in. You feel me touch.
Mm-hmm.
Any pain or tenderness as I touch?
No.
Very good. I'm going to go ahead and move along to your scalp.
Okay.
Again, feeling for any sort of lesions, masses, excuse me, or anything that's protruding. It all feels nice and soft. Appears to be an even distributed hair, color nice and even, like I said. Okay, perfect. I'm going to go ahead, palpate your frontal and maxillary sinuses.
Okay.
Let me know if you have any pain
Sure.
or tenderness as I do so.
No pain.
Good. Maxillary.
No pain.
Good. And I'm just going to go ahead and palpate your orbital. Let me know if there's any pain or tenderness.
No. No pain.
Good. Very good. I'm going to move along. I'm going to take a look at his trachea, make sure it's midline, and it appears so. I'm looking for JVD. It doesn't look like there's any jugular distension whatsoever. I'm going to palpate. Very good. And now I'm actually going to have you swallow. I'm going to feel your thyroid. Very good. I'm going to go ahead and feel for your lymph nodes, starting with your postauricular, preauricular, mandibular, submandibular, excuse me, submantle, supracervical, posterior cervical. Very good. And clavicular. Very good. Okay, so I'm going to go ahead and I'm going to test the 12 cranial nerves. Starting with cranial nerve number 1, I'm going to have you close your eyes.
Okay.
And I'm going to put something underneath your nose. Let me know what it smells like.
Alcohol.
Very good. And like I said, we already did the Sneller's test previously, so we've already tested his vision, which is optic nerve for cranial nerve number 2. But I'm going to go ahead and look at your peripheral vision and looking at your cardinal field. So I'm going to have you stare at my finger here, and without moving your head, follow my fingertip. Just with your eyes. Very good. Okay. Very good. Excellent. Since I have you there, I'm going to have you look at my finger.
Okay.
And I'm going to bring it into the point of your nose. Keep on staring and coming out. Good. And his pupils there constricted as I moved my finger closer to his nose and dilated as I came away from that point. Very good. I'm also now going to have you clench your teeth really tight for me. Very good. I'm going to have you close your eyes and let me know what side that you feel a soft gauze on your face. Very good. Excellent. Okay. Cranial nerve number 7 is cranial nerve number 5 is intact. I'm now going to have you raise your eyebrows really nice and tall. Very good. Squeeze those eyes really tight. Very good. Give me a nice smile. Very good. Nice frown. Good. Excellent.
I don't frown much.
Okay. Cranial nerve number 7 is intact. I'm now going to whisper something into your ear, and you're going to repeat it for me after you're here.
Pulse ox.
IV.
IV.
Very good. Cranial nerve number 8 intact. I'm going to have you shrug your shoulders and against, yeah, very good. Now I'm going to press against your head, and I want you to not let me push you. Very good. And the other side. Very good. Cranial nerve number 9 intact. And just kind of going back, well, we'll go over that later. I'm going to do cranial nerve number 11. I'm going to put some gloves on. Since I'm going to be in your mouth, I'm just going to do a full inspection, if that's okay. Take that, get that taken care of. So I'm going to open up your mouth, so have you open up your mouth nice and wide for me. I'm going to have you go, ah. Very good. Uvula went up, soft palate went up, so cranial nerve number 11 is intact. It looks like tonsils are intact as well. Keep on, very good. Tonsils are intact, grade number 1. Mucosa is nice and pink. I don't see any lesions or any abnormal colors. I'm going to have you lift up your tongue for me. And good, uvula, or excuse me, your frenulum is intact. Very good. Let me just take a look at your lips too. Very good. Any issues with your mouth at all? Any sores, cold sores, or anything? Okay, very good. Excellent. And since we're still on your mouth, I'm going to have you stick out your tongue. Good. Move it side to side and up and down. Cranial nerve number 12 is intact. And we have finished all of those. Now we're going to go. I did forget to look at your nails.
Oh.
Let me take a look at your nails. Looks like we have good cap refill, less than 2. Very good. No ridges. All even. Very good. Okay. I'm going to palpate your carotid. Also listen. And also palpate your temporal. And also take that. So you're going to feel me touch. Good. Bilaterally, nice blood flow. I'm going to palpate your carotid. Bilaterally equal. Okay. I'm going to take a listen and make sure there's no bruise. And again, equally bilaterally, good blood flow. Moving along, I'm going to have you, I'm going to take a look at your eyes.
Okay.
Let's start with, because we already did that. I'm going to go ahead with a nice and bright light. Okay. I'm going to have you look over my shoulder. I'm looking for your pupil response to, and if it's reacted to light, which it is, on your left pupil. And your right pupil is also perla intact. Appear to be about a +2. Both sides equal. Now I'm going to go ahead. I'm going to take my glasses off. It's a little bit easier so I can take a look. And I'm doing the red reflex, which is positive. And I'm looking at all 4 quadrants of your eye. Very good. Going on here. And yep, red reflex is present. Very good. I'm also looking at your optic disc. Nice and flat. And fundus is also intact. Let me look on the other side since I did not do that. Nice and close here. Very good. Now we're going to check your peripheral vision. So I'm going to have you cover your left eye, mimic me, mirror me. And when you see a number come through your side, let me know what number I'm holding up.
2, 3, 2.
Very good. We're going to do the same side, or the opposite side, excuse me.
3, 2.
Very good. You can relax there. Now I'm going to go ahead and look at your nose.
Okay.
Just again, inspection wise, make sure nice and midline, no deviation, which doesn't appear so. I'm going to take a look in your nares. Nice and pink. Looks like no obstruction from here. Septum is nice and midline. And I'm going to have you just do a little test for me. I'm going to have you obstruct one nostril. Breathe out. Good. We'll do the opposite side. Very good. And moving along to your ears. I'm going to take a look. I'm going to palpate, inspect, make sure we don't have any lesions, masses, bruising, any kind of abnormalities. I don't see any piercing holes. Very good. Any pain or tenderness when I do that?
No.
I'll start on this here. I'm looking for any obstructions. I'm going to look at your tympanic membrane. I'm going to pull up and out. And let's see, your tympanic membrane is nice gray, pearly in color. I don't see any obstructions. Cerumen is not present. Very good. I hope you don't use Q-tips. Very good. I'm going to pull out and up and out, excuse me. Taking a look. Again, tympanic membrane is nice and gray, pearly in color. No obstructions and no cerumen that I see. Nice and clear. Very good. All right, I'm going to do another test. But I don't know if I looked at I didn't look at your sclera before. Going back to the eye exam, I would have already inspected sclera, which is nice and white, and conjunctiva is nice and pink in color, and no drainage that I can see. Okay, we're doing the Ryan's test. So I'm going to, this is a little bit of vibration that I'm going to place on the top of your head. I want you to let me know if there's any difference between the two, or if you can hear sound on both sides. Okay.
Yep.
Can you hear?
Both sides.
Both sides. Okay. Very good. Now I'm going to test your conductivity of this, comparing your bony prominence to air conduction. Thank you. And that should be a 2 to 1 ratio, with the air being longer than the bony prominence. Okay. So I'm going to start counting. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6, 7. Okay. I'm going to go ahead to the other side. Same thing.
Okay.
Let me know when it stops. 1, 2, 3, 4, 5, 6.
Okay.
1, 2, 3, 4, 5, 6, 7, 8.
Okay.
All right, and that concludes the Ryan's test. Or the Weber test, excuse me. Okay, so now I'm going to move along. I'm going to do chest, lungs, and cardiac after that. So right now I'm just looking at you, making sure that you're not in any distress, making sure your respiratory rate is nice and regular, no shallow breathing. Again, it looks nice. I'm looking at his AP diameter, and that should be a 2 to 1 ratio, looking at anterior side and then lateral side, which appears to be a 2 to 1 ratio. Very good. I don't see any concaveness or anything to the chest, no barrel chestedness or anything. All right, I'm going to go ahead. First thing first, I'm going to check to see if you have any crepitus. Make sure there's no unwanted air that shouldn't be there. Any trauma or anything recently? Okay, very good. I'm also now just going to go ahead and have you say 99. And I'm just going to feel across your chest, looking for tactile fremmatitis.
Okay. 99, 99, 99, 99, 99.
Very good. Do the same thing back here.
99, 99, 99, 99.
Very good.
99.
And equal on both sides, which is how it should be. I'm just now going to take a listen. Oh, and also I don't see you using any sort of accessory muscles at all. So I'm going to have you, as you feel me touch, take nice, deep, even breaths. Go on back. Breath. Very good. Clear throughout and equal bilaterally. I'm now going to go ahead and do some percussion across your back. I'm looking at your diaphragmatic excursion. So I'm going to have you take a nice deep breath in and then let it out. And then I'm going to have you let out a nice exhale and hold it there as well. And I'll let you know. And then what I'm going to do is I'm going to measure that point. And I should have the right pen, which I do. It should be about 3 to 6 centimeters in diameter. I should have this ready. Okay, you're gonna feel me percuss. There should be resonance through. I should not hear any dullness. That would be indicative of consolidation, which we do not. Which would be an abnormal finding. Okay, I'm gonna have you take a nice deep breath in and hold it. Good. Okay,